The richest state of India, Maharashtra, has imposed night curfews and tighter travel restrictions after recording the highest one-day spike in coronavirus cases of any Indian state since last March. Highest single-day increase since the beginning of the pandemic, and most of them in the densely populated Pune, Nagpur and Mumbai. So what is the reason behind the rising number in Maharashtra? Is it a new mutant variation? Is it institutional carelessness? Or is it just us? Will a second lockdown happen? And should it? Let's find out in today's episode of Thought Control. But before that, I would encourage you to subscribe the channel if you haven't done yet. Maharashtra on Sunday accounted for at least two-thirds of the total cases across India. While the country recorded 62,740 new cases, biggest jump for the country since October. Maharashtra number was 40,414. That's the state with 7 to 8% of the population, and it's responsible for more than 60% of the total cases. In fact, Maharashtra has been having at least all of the new daily cases across the country. Residential areas in Mumbai with 5 or more cases have already been ordered to be sealed off. But can the nerve center of the country's economic activity go through another lockdown? Well, the state government has spoken and officials have been asked to prepare a roadmap for a second lockdown to implement it in a phased manner, as its own alliance and the central government have suggested finding other solutions. The decision is likely up for review till 2nd April. Overall, the state has 3.57 lakh isolation beds, of which 1.07 lakh are occupied. Of the 60,349 oxygen beds, 12,701 are occupied, and 1,881 of the 19,030 ventilators are in use right now. 15.56 lakh people are in home quarantine and 15,852 people are in institutional quarantine. Some corporates also have raised concern over the rising coronavirus cases and called upon the CM for emergency permission to vaccinate everyone willing to take it, as they feel that more lockdowns will hamper the state. So what is it? Is it a new variant that causing an upsurge in the cases? Well, a double mutant variant indeed has emerged in India, and it was first observed in, you guessed it, Maharashtra. What is a double mutant variant? Well, a double mutant variant occurs when two mutations of a virus come together to form a third one, Q, which is a domestic mutant, and L452R mutation, which was traced back to US. Genome sequencing and sample testing have been confirmed that there has been a rise in E484Q and L452R mutations since December. So is this variant the real cause for rise in cases? Well, some experts do fear the alarming spread with which the newer strains are spreading. It can make India's second wave of infection worse than the first one. What is surprising is that the previous mutations, including the 70 times more infectious Kent and Brazilian variants, have very rarely been seen in India. But this double mutation is adding significant number of positive cases in the second wave of India's fight against COVID. Though there is no concrete evidence, epidemiologists believe that not only is the double mutant variant causing a rise in number of cases, but it also have a greater ability to surpass our immune system and be highly resistant to antibodies. So it is spread faster even inside the body. Also should be noted that Health Ministry has not yet declared this double mutant variant as a variant of concern. So what else can it be? The slow pace of testing is what experts think is the main reason behind the rising number of Maharashtra. The average per million testing for COVID in India is 1,62,697, which means the country on an average conducting 1.62 lakh tests for every 10 lakh people. For Maharashtra, this figure stands at 1,33,313. This prevents the state from catching the cases early on and lets them spread much more. And while the most people would blame the poor and uneducated for spreading the virus, according to the government officials, high-rise residential buildings are actually seeing a higher COVID positive rate. than the slums. Hotels, pubs, and shopping malls are major contributing factor. So low speed of testing is the reason? I mean, yes and no. As there are multiple factors, of course. The crowd that gathered during the mid-Jan Gram Panchayat polls, the careless approach of people towards the face mask and other protocols, early opening up of recreations and entertainment activities. But the most important factor is still human error. People have started being careless with virus. According to the health experts, people have started believing that the virus is no longer dangerous. Let's see how much of this is true. Last year in September, when the COVID cases were at their previous peak, people were being very particular about staying inside their homes. They were following all the safety precautions to protect themselves and others from the spread of virus we did not know much about. As the number decreased a little, people began to relax. Now when cases are clearly reaching a new peak, people are undisturbed as they have been going outside, traveling, visiting restaurants for quite some time now with not much problem. Despite warning by health officials, many people don't actually mind risking getting the infection as long as they get to do their work, go out and meet people. The worry and scare have been replaced now by arrogance and overconfidence. Some part of this misleading sense of security is brought by the arrival of vaccines, but mostly it is just not as scary as it was last year when we did not know how deadly it can be. Even as COVID-19 cases have been rising more than 40% since March 1st, the case fatality rate has been lower than 0.55%, significantly lower than 2.3% reported in March 2020. We now know that the virus's ability to cause disease in an infected person is quite low. Even when its transmissibility remains high, fear of COVID is at an all-time low. You see, last year people were not worried about the news of rising cases. They were worried about the people dying. We did not know that in most hosts, the virus does not even crop up symptoms. Most people no longer even see COVID as an epidemic, but an illness just like cold or fever. Simply put, last year coronavirus was a new disease, but now we are used to it. The vaccine is also here. So for some, it really feels like the pandemic is over. But not for our health officials. The careless has been tiring for doctors and health experts across the globe. Maharashtra is back to square one, and while people are tired of the pandemic and just want to relax, what they forget is the intense fatigue in the medical community, which has now been fighting COVID for an year. Senior physician Dr. Tushar Shah of Mumbai emphasized that as doctors, they just can't cope with the rise in the cases. Shah also dismisses the claim that COVID is on its way out. He said, people think vaccines are a hope, but vaccinating a population of this size will take a long time, during which mutations might get stronger. So we have to keep our guard up. Dr. Daksha Shah, the Deputy Executive Health Officer of Mumbai Municipal Corporation, also appealed to people to change their casual attitude. The number of hospital admissions have been rising in the last week, and it is a relief that deaths have not gone up, but we still do have many critical cases, she said. What we need to understand is that there are still vulnerable sections of population around us. Senior citizens, women over 40, or those with weak immunity or respiratory conditions. And for their protection, we have to take this seriously. Aggressive testing, speedy vaccination drives, and careful rule-abiding citizens is what will get out of this. Remember, the fight hasn't ended unless it has ended. Thank you so much for watching this video. If you have any feedback, please let us know in the comment section below, and do not forget to share and subscribe. Please spread this word so that all of us can be little serious about this pandemic. Else 2020 can be repeated. And none of us want the same. Thank you. Bye-bye. Hello. 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 Thank you, yaar.